Hi, I'm Ian O'Grady, past president of PSI and chartered psychologist. I want to talk a little bit today around OCD and around obsessive thoughts that people may be having during the COVID-19 crisis. So, OCD is a mental health difficulty that affects people of all walks of life and of all ages. And this occurs when people get caught into a cycle of intrusive thoughts, images, or urges popping into their head and then behaviors that they do to try and neutralize or to reduce the stress that these cause. So the compulsions that people engage in tend then maybe to cause more problems than the worries in the first place. So many people have obsessive thoughts or do things compulsively at some point in their lives, but many more are doing these things now because of worry and anxiety that's there because of COVID-19. What's important to know is that people doing these doesn't make them a little bit OCD, or it doesn't make them have some OCD, or it doesn't make them be a little bit OCD. And sometimes these phrases that are a bit glib and a bit throwaway can be quite hurtful and quite dismissive for people who have a serious mental health difficulty like OCD. But what's happening in the world at the minute can make things more difficult for people with OCD. This isn't just in relation to people who maybe worry about contamination or who maybe worry about dirt or germs on their hands. There are other people who may right now be worrying about infecting someone else and this being their fault. Or they may be worried around that they're not able to clean their house to the standard that they wish and that they might be judged for this if corona gets in or if COVID-19 gets into their house or someone in their family might get infected with it. There are also people who've had treatment for OCD who I'm sure right now are worrying around the impact of the isolation and how this will be for them. And I suppose what this will do is that it will make them maybe worried. It will make them concerned that maybe they're going to slip in how well they're doing, or concerned and that they're maybe going to have a relapse. So, what I'd like to talk about now are a few tips that people can do. So, the government have produced guidelines in relation to hygiene and social distancing. And it's important that people stick to these, especially people with OCD. So the government has said wash your hands for 20 seconds in soapy water that's warm above 25 degrees. And it's important that people do it, and everyone does this at the appropriate time, but it's important that we don't do too much more than this. So, washing your hands for a longer period with hotter water or with more difficult substances for your skin might lead to more infection later on down the line. It might lead to hands being chapped or hurt, and it might not be all that helpful. It's also important that if we're thinking of cleaning our houses, that we disinfect them and we follow the guidelines, which would say that we do this once or twice a day. If someone comes to visit, which I suppose unless we have a carer coming in, they really shouldn't. But sometimes in families, someone will have to go do essential work. So when they return, they may clean themselves. They may clean some of the surfaces that they touch, but it's around if you've been in the house for an hour or two and there's no one there and you've already cleaned, there mightn't be a reason to clean again. It's important when we're isolating that we stay in. This is the guideline. But we're also allowed exercise. We're also allowed get out for essential trips. So if your OCD tells you you must stay in totally 100% of the time, think in terms of, can I get out for a walk? Can I walk to the shop to get something that I need? And the guidelines would suggest, yes, you can, once you keep social distancing and once you keep trips like this to a minimum. It's also important that you have a trusted person that you can talk to. So talk to someone who understands you, who understands your OCD. Bounce your ideas off them and come up with a strategy as to what is an okay amount of washing, cleaning, or reassurance seeking. It's also important maybe to limit the amount of news that you take in on a day. So 5 to 10 minutes should be sufficient. And when you're doing this, very much pay attention to the facts, not how you feel. So news like this will be disturbing, it will be distressing, but the truth is in the facts. How you feel may lead you to have some hooks from your OCD come in, and this may lead to more worry and more behavior that happens afterwards. It's also important to know that while social connections virtually are really important, there may be times that we want to take a break from our phone, take a break from connections, or there may well be people that we want to take a break from. So feel no guilt about blocking someone who's been unhelpful or removing yourself from a group if you're feeling a bit overwhelmed. It's important to know that when big events like this happen in the world, that no one is doing as well as they were doing beforehand. So if things have slipped a little bit, if you're a bit worried that maybe you're engaging in some OCD behavior a little bit more than usual, that when this happens, that's okay. This crisis will pass. And when it does, you can re engage with your therapist, you can re engage with family and friends, and you can pick up these steps along the way. Don't hesitate to contact someone who has provided support during this, such as your therapist. They may be able to offer you sessions over the phone or sessions over Zoom or other video platforms. It's important to note that when this passes, there will be time for people to make steps back towards the gains that they had made previously, or else for people to set out anew and make these gains. To get further information around this, please visit the PSI website and look at the resources that we have available there. There are other available resources on the PSA website, such as the Find a Psychologist section, where you'll note that our members have indicated whether they're open to give video or telephone based psychological therapy as well. So, thanks for listening, and I hope this has been helpful.